For many, the coronavirus seems to be going away. But is that really the case? Then there's the question of who knows somebody who has the virus. Today on Say It Loud, we hear from a survivor of the fast-spreading pandemic. He'll tell us all about his journey to recovery. My name is Lord Harisudasari. When we return, we introduce our guest. Thank you for joining us. You are still watching Say It Loud. And our guest for today is a medical lab scientist and a COVID-19 survivor. He's in the person of Francis Bigoja. Francis.
Hello.
Thanks for coming on the show.
All right, thanks for inviting me too.
Great. How did you get coronavirus?
COVID-19 is no respect of persons, irrespective of the work you do or your personality in society. I mean, you can be infected with the virus. Okay, so I personally believe I got infected in the line of duty. Like you rightly said, I'm a medical lab scientist, and then I was a contact tracer in the Adenta Health District. Okay, so we were actually following up on contacts that were given to us by the Immigration Service, and then through the Health Directorate, and then we followed up on them to make sure that they get tested. We collected their samples, get tested, and then we provided them the results. So actually, I was actually in direct contact with the patients or the clients that we had to pick up samples from. So I had to give them instructions as to how to collect the samples for the testing, and then also pick up the sample.
So how are you doing this? Were you going from home to home, or from, what was the routine? How was your routine like?
Yeah, so okay, every day we had contacts. Okay, so we called the contacts, and then we informed them that we had their contacts for what's the name? A contact tracing exercise. Okay. So we called them on phone, and then they directed us to their location. So we had a vehicle that was dispatching us to their various locations. So we visited them in their various homes. Yes, and sometimes we call an individual, but when we get to the home, we realize that there are maybe a set of family there. So we test them, we pick their samples and test them, and await that results will come and be given to them.
How many were you in your team?
Oh, okay. So a team consisted of 3 individuals, 3 people, as in 3 health workers. Okay. So 2 were contact tracers. They were filling up the forms. That's the what's the name? There was a form that you fill, okay, and take particulars of the patient or the contacts you are dealing with. Then, as a medical lab scientist, so every team had a medical lab scientist, okay, who was making sure that they take appropriate samples and then collect samples, transport samples in a good medium to the right institutions to be tested.
So at what point did you know that you had been infected?
Okay, actually I was caught on the 6th of May. I actually also did a test. Okay, yes, so we also did a test as health workers. I mean, so it was a Wednesday. I got home, and then in the evening, some of my colleagues called me. My team members told me that the test that I did.
Even before you continue with that, when did you do the test? Was it like a voluntary test that you went to do, or as officials you were made to run tests before you went out to go and?
It was voluntary, but as a health worker, I also saw the need to be tested. Though I was going around picking samples from individuals to be tested, it was necessary that I also get tested. Yes. When
did they tell you that your results were ready, and what was going through your mind after you ran the test? After you had gone for the test?
Well, as I stated, I was doing contact tracing. So when I did my test, when I picked my samples for the testing, I was still doing the contact tracing. Yes. Until on the 6th of May, I was informed that I had COVID-19. Okay. So, well, for me as a medical lab scientist, it wasn't a big deal for me.
It wasn't?
Yes.
So there was no form of fear or...
I was actually thinking about my family, how they would take it, because it's not all of them that are health practitioners or health inclined. Okay, so I had to find a nice way to tell them.
You're the one who told it?
Yes, I had to tell
Wow.
them. Yes, I had to tell them and then make sure that they also get tested because I was living with them.
Oh, right. So how many people are in your household?
Oh, okay. Fortunately, my parents were not around.
Okay.
So my sister was around. Okay. So it was my sister who had to be tested. Yeah, so my sister got tested.
How was the entire atmosphere like? Did you experience any form of stigmatization?
Yeah, well, when it comes to the stigmatization, it's quite real. Yes, I think personally it was one of the reasons I had to resign.
You resigned?
Yes.
Resigned from your workplace?
Yeah, from my workplace. Okay, I had to resign from my workplace. Though, I mean, there were other issues aside the stigmatization, not just from workplace, but I mean, from some few people around as well. Okay, yeah. So I thought it's wise to, I mean, take stock of my life and then just hold back for a while.
I want to know a bit more about how you getting COVID contributed to you resigning.
For privacy issues, I would just want to withhold, I mean, certain information or certain names.
Okay, if even if you do not want to communicate where you were working, we just want to know the general stuff, how things were like. So you were working in a hospital or organization? What kind of...
Yes, a hospital.
Okay.
Yes.
And tell me more about how the stigma was, because you were a health giver.
For me, I felt upon the various inputs and my efforts in the facility, and such comments could be made with regards to my status as having contracted COVID-19.
Which comments were made?
Or let's hold on for that for now. Or my work as a contact tracer. Okay, so irrespectively, even if I stop doing the contact tracing, I am still a medical lab scientist.
I mean, you said you were stigmatized, but what kind of stigma?
Well, that still boils down to giving you fine details about the COVID-19 issues as to how the standard procedure, how everyone is going to deal with COVID-19 issues. Okay, so I mean, the facility had to close down certain units, okay, and then ask certain individuals to stay home for a while and then isolate themselves.
The last thing that made you draw the conclusion that, okay, this is it for me, I'm walking away. What was it?
It was the COVID-19 stigmatization that broke the camel's back, aside other issues like money issues and stuff. Yeah, I mean, delay in monies and payments.
Delay in money payments. Give me a little light on that.
Oh, I mean, not just the facility I work in, but there's usually a financial challenge in the delay of salary payment, you know, and stuff. So,
okay.
Yeah, there are other issues that contributes to that.
How long did it take you to recover?
The normal days. Okay, so I had to undergo, as at May, I had to undergo 2 negative tests. Okay, after the initial first positive. Okay, so I had to do 2 tests. So on the 6th of May, when I was informed about my status as being positive, I start, quarantine myself in the house. Okay, I did a self quarantine. I didn't go to any isolation center, and I had to buy medications myself. Yeah, I had to buy medications myself.
Wow.
Yeah. So after 14 days, then I did the first test. Then I think after 3 days or 4 days, I did a second.
Francis, let me just hold you right there, but we'll take a quick break here. We've been speaking to Francis Bigoja. He's a COVID-19 survivor. Now, when we return from the break, he'll tell us how he went through the recovery process and everything related to his recovery and the coronavirus. Stay with us. Welcome back. This is Say It Loud. We've been speaking to a COVID-19 survivor in the person of Francis Bigoja. He's also a medical lab scientist. And before we went on a break, Francis was just telling us how he managed through the recovery process. Francis, so you stated that you had to isolate yourself. So it means that you weren't picked up by any ambulance of any sort?
No. Actually, what I know and what was being done in the system was they had a team, as in a virtual team, okay, that was monitoring you, okay, as part of the what's the name, team for the COVID-19. Okay, so we had people who picked up samples and to get tested. If your result comes out as positive, and they move you to the treatment team, okay, which comprise of the physicians and then some other health workers. Okay. So they call you, they talk to you and stuff. Yes, but when it comes to the medication, you have to buy them yourself. Yes, I may not be able to speak for those who had to be isolated in the health facilities. Okay, I can't tell about that. Perhaps, maybe they provided them. I want to believe so, that the facility provided them the medications. But for those of us who had to isolate ourselves in the house, we had to buy the medications ourselves.
And how often were you buying them? And when you bought them, how long did it take before?
Well, it was dependent on the individual's case and severity of yours? Well, mine was very mild and close to asymptomatic. Okay, yes. So actually, when I was informed, I was quite surprised because actually, boy, I did formal. I'm fine.
You're still fit. Nothing to show.
Nothing to show for.
No, what were the mild symptoms?
Mild symptoms, like later I realized that I had loss of smell. Okay, so I actually didn't know that was part of the signs of COVID-19, okay, or symptoms of COVID-19. Yes, so that was the only thing I could recount noticing in myself.
Let's talk about the atmosphere in the house. I mean, once you isolated yourself at home, you said you were with your sister.
Yes, yes.
How was the whole thing like?
Okay, so my sister, you know, when I told her, I'm usually someone who goes straight to the point. I don't want to beat about the bush. I just tell you point blank. So I just called her. Then I told her that I'm a twin, so she's Francisca. Okay. So I told her, Franca, Charlie, yes, I have COVID-19. And I just laughed. I just laughed. Then I showed her the screenshots. Okay. Then I mean her facial expressions began to change, her countenance.
Wait, was it a video call?
With her?
Yeah.
No. I mean,
no,
I was in the house. So I was in the house with her. So I called her physically to come. So we had a chat. So it was the next day you know, we have to have good systems that will track as a health worker. The kind of challenges I had to go through getting people who had contact with me to be tested was even annoying.
You had to do that yourself?
Exactly. So how much more someone who doesn't know or who is not privy to some of these informations.
Enlighten me a bit. I mean, you worked
as in the norm. Yes, the norm is that when you get infected,
yeah.
where you've been in some past few days, I've quite forgotten that, you are told to recount those places and then the people you've come in contact with. Okay, so you provide their names and their contacts, and then the contact tracers begin to call them. Okay, so in my case, the people that I provided, they didn't call anyone. No, I had to,
How did you know they hadn't been contacted?
Oh, I asked them. Yes, some of them were very close, and I even told them that this is the case. So I want you to also get tested. Okay. And they were fine by that. Okay, so I had to arrange that they go to a facility I want to just withhold and then get tested. You get the point? So just imagine someone has COVID-19, the person provides contacts that he has been in touch with, and you don't get people to follow up on those individuals. Do you think it's a good thing? The COVID-19, people will just be getting infected day by day.
So in your case, did you infect any other person?
Well, I can't tell because you wouldn't know who infected you. The best you could know is where you were, who you came in contact with, and then possibly think about who had COVID-19 there or not.
But as far as you are concerned, the people that you had
But the people that I had contact with after the test, fortunately, they came out all negative. Yes. Even my sister that I was living with came out negative. But I had to take a preventive measure. Okay, so the medications that I was taking, she also has to take some as a preventive measure. Yes, you can't leave anything to chance.
But it wasn't, it was prescribed?
It was prescribed, but yes, it's an antibiotic. Well, I was just contacted once by the health team that was supposed to, take care of people.
Be monitoring your...
Yes, be monitoring. Okay. They just called me once. So I had to switch to UGMC COVID Connect, okay, where I signed up to their Lucy app, and then I was using the app. So they were calling me constantly to check how I was doing.
Wow, but the people that did it...
But the team that was assigned, okay, to take care of or to monitor those who have been infected with COVID-19 in their locality. Well, they just called me once. Wow. Yes. So if they call you a health worker once, okay, someone that you were working with, they just called you once. How much more someone who doesn't have any relation with? Yeah.
What is your general impression? I mean, looking at everything that you've gone through when you got infected, what was the one thing that kept coming to mind about how it was?
The one thing that came to my mind was that if I had died, it would have been a stupid death. I would have died for nothing, foolishly. Oh yeah, because you see, we should have system in place that would protect individuals who are willing to, sacrifice, go the extra mile to make sure that people are well. This is just one aspect when it comes to the health sector. I'm sure other people have issues in other sectors, but personally for me, it would have been a foolish death. Seriously.
As a health worker or as a contact tracer?
As a health worker, as a contact tracer, as which have you? Not to even talk about the PPEs that are supposed to be supplied and a whole lot. You get the point? So,
did the government come through for you with all the promises that they made
on the PPEs? Oh, they did their best, but it wasn't sufficient. Yes, they did their best, but it wasn't sufficient. There is a prescribed nose mask that's supposed to be used by those who are coming in contact with COVID-19 patients. Okay, you can't use this one. You understand? You are supposed to use the NK95. Okay, that's what is prescribed, and you can't use the cloth one. You get the point? So you need to be well protected in your PPEs, your boots, your gloves and stuff. Okay, so well, they did their best, but it wasn't adequate.
So let's talk about the aftermath of you recovering. Health experts have stated that people who recover from COVID tend to have long-term effects. It could be sometimes lung issues or breath, several other things. Since you recovered, I mean, it's been 3 months.
3 months
since
yes,
May,
yes,
right?
Yes.
What has your experience been? Have you experienced any odd thing with regards to your health?
Okay, I think no. But you know, sometimes the thought, for instance, when you cough one, you're like, hey, Charlie, I don't know. No. Or you are having some runny nose or something. Yes, but well, it's been 3 months down the line now, and I think I'm okay, I'm healthy and fine.
If you compare how you were, I mean, regarding your health, how you were before and post COVID, is still the same, or what has the changes been?
Oh well, the only change is that I've put on weight. Because in the 14 days I actually had good time to sleep. You know, added that eat and sleep.
Yeah. Let me draw you back a bit. When you experienced the stigma and all that, did it take a toll on you mentally? And if it did, how did you fend it off, or how did you overcome it?
No, there wasn't any mental irritation that I had. But well, it all boils down to the decisions that we make in life based on what happens to us. Okay, so well, to me, I felt getting off was the best, and then I would just take stock of my life and then re-examine some few things and then move forward again.
Did you lose any friends?
Friends, actually, well, I had a lot of friends too, as a result of the COVID-19, you know, because I was writing on my WhatsApp status and people will call me, hey, is it true? Are you sure? Hey, so which medicine did you take? What do you think? Like, well, you need to get appropriate counsel and stuff.
You said that you were taking the same medication with your sister.
Yeah, with my sister.
As a precaution.
Yes, preventive.
Preventive measure. So does that mean that you buy into people who were taking, who are self-medicating because of COVID?
It depends on the perspective, because if you really look at the situation at hand and you're actually waiting for maybe the government or someone from somewhere to provide you with medications or something, or to provide you with counsel, or better still, to even help you get tested and then wait for your results. You know, I had to wait for, I think, a week or 2 to get the results. Really? Yes. Some even wait for a month. So within that time, what do you do? Okay, so I wouldn't advise that people self-medicate. But you see, your life is more important than policies and standards of operations or whatsoever. If you have a friend or a relative who is in the health sector and can help you, maybe a doctor, a medical lab scientist, a nurse, a pharmacist who can assist you, why not? Okay,
since you're here, which medicine
Which medicine did I take?
Yes.
Okay, the medicines I was taking was azithromycin, 500 milligram, and then the dissolvable vitamin C tablet. Yes, but I know sometimes it can be disturbed a little, so you tend to do other traditional methods.
Like what?
Oh, like neem. What was the name? The neem tree, the leaves. Okay, so you boil them and then steam inhalation.
Apart from neem?
Apart from, no, that's the only one I know. And I also did as well. It wasn't quite easy, but you know, you have to force and do it.
Francis, your journey as a COVID survivor, what's the one thing that you would not do? I mean, looking at everything that you have gone through, what's the thing that you would not repeat so you won't follow the same trajectory?
For me now, I've advised myself on issues that have to do with outbreaks, okay, pandemics or either epidemics and stuff. Yes, to closely involve myself as a professional, sorry, in the let's say testing or whatsoever. I've advised myself not to do that again. But if we have a good system that seeks the welfare of the people who are involved in taking care of the sick and needy, why not? I'll go ahead and do it. But if I see that it's not so, it's just like what I experienced, I wouldn't do. And neither will I even advise someone to do. That's the point. I won't even advise someone to do.
Everything you're saying here gives me the impression that government did not come through with their promises on taking care of contact tracers, the insurance and all that. Is this something? With
yes, the insurance. What is the insurance? There is a health insurance, a life insurance for.
It's not a high. Yeah. Na kukumule eka particular yo. Kukumule ka. That's how high kukumule.
19 and a whole lot. We are almost in the 4th month now, but nothing.
Have you made any
inquiries?
To reach
well,
out?
We've made several inquiries. You know, aside the insurance, well, there were monies that were supposed to also be paid to contact tracers.
Yeah, I know initially you were paid 1,500, no?
No, 150.
Sorry, 150,
yes,
and it was reduced to 70.
Well, we didn't even have the chance to even get that 70.
How do you mean?
So, our colleagues in Kumasi were being paid 70 cedis in the month of May. Okay, so you know we started, the president announced. So, we actually started working as contact tracers on the 1st of April.
Yeah.
Okay, but you know, the president didn't state how long it was going to last.
The contact tracing?
The contact tracing. So, after working for 2 weeks and being paid, they paid us for 19 days. Okay, and then some of us had also worked for the whole month of May. Okay, some of my colleagues had worked for the month of May because I started my isolation after 6th of May.
Yeah.
Okay, yeah, so someone had worked in the whole month of May, and we're hoping that the monies will come, only for us to be informed by the Director General that we were contracted for only 19 days, whilst we had worked for all this while. You get the point? So they are close to 6,000 Ghana cedis per individual in the district that I worked with, okay, at Dental District.
Yeah.
That are still pending, and we don't know what is going to be done about it. We've spoken to the director, you know, he's also making every effort to make sure that this issue is resolved, okay. But up to now, we've still not had any positive feedback.
When was the last time you tried to get this resolved? When was the last time you reached out to?
Yeah, so we had to organize a meeting with the director, and then he said he will forward it to the MP.
When was this?
Oh, this was somewhere in June.
Okay.
This was somewhere in June. Okay, this was somewhere in June. So I had to forward this to the MP. I think the last information we had was that the MP said they should come with a budget, okay, for those durations, and he will present those budgets to the Director General and see how best they will rectify that. But up to now, I mean, we've still not had any positive
feedback from them.
Yeah.
Well, Francis, I'm sure you've observed by now that, for want of a better word, people are not afraid of COVID anymore, or that's how it at least looks. Yes. You don't see people adhering to the safety protocols. You don't see the wearing of masks and all that. How does that make you feel for someone who has recovered? You know how real it is, because there are people who do not even believe in it. How does it make you feel, and what's your message?
Well, it's a what's the name? It's a standard that everyone should put on a nose mask to as a preventive measure. Okay, so that you don't get exposed to COVID-19 in a way. All right. But when people become so reluctant, it means that information and knowledge is not really going down the drain. And then we tend to see that, well, the COVID-19 that they said is not as serious as it is. Okay, so then why not just take off the mask and then still move away?
So you think education is no longer as strong and vibrant?
Yeah, the education is not as strong as, and then one of the factors I think is also influencing this is, you know, the daily updates that is being provided by the Ghana Health Service. Today, as at the time I checked, the new cases were 64. So just look at the country, you know, a country as Ghana, and we have a case of 64. You begin to ask yourself questions. If truly that's the figure, then it means that the COVID-19 is suppressing. But if not, the other issue, the other contributing factors, but that's not that withstanding. What I want to say to everyone there is that you need to be responsible. Okay, so you need to make good choices for your life. You don't have to wait for any policy to be made. You are responsible for your own life. Okay, so you have to make good decisions for your life, for your family, and for your community. The interesting thing about the whole COVID-19 is that your safety depends on mine, and my safety depends on yours. So if you put on a nose mask and I don't put on a nose mask, you are still at risk. Okay, so we all collectively need to put on our nose masks and then make sure that this COVID-19 becomes a thing of the past.
Before I let you go, one more question, or maybe last two questions. How has your life changed?
Well, it's made me very meticulous, very careful. Yes, and then I see things different. Okay.
How do you see things now?
Yeah, well, death can happen to everyone. I know medical lab scientists, doctors, nurses who have passed on as a result of the COVID-19. And I feel I'm not so different. Okay, so I see life very different. I think every day that's given to us, it's best we make good decisions and good choices out of them, so that when we are no more, I mean, good things will be said of us.
Thanks for your time, Francis. But that's it on this edition of Say It Loud. We have been speaking to a medical lab scientist who is also a coronavirus survivor. Now, the virus has not gone away, and so we all are supposed to adhere strictly to the coronavirus protocols. My name is Lord Harisida Sari. Do join us next time.